Well, I hope you all enjoyed the lunch as much as I did. And by all means, if you're still eating, finish up, no problem, and enjoy your dessert. How about a round of applause for our Radisson Blue staff and the venue here? So thank you so much for joining us today for today's program, Tackling Homelessness. Our program is intended to be an information gathering session so that we all leave here with a better understanding of the scope of the problem, the challenges facing our authorities today, and some of the progress being made. Tackling homelessness has proven to be one of the more complex challenges facing local governments across the nation. You've no doubt seen or read about the massive encampments in Los Angeles and San Francisco. We face many of these same situations here in Minnesota, though thankfully not to the extent of those locations. Authorities are learning that the problem doesn't fall neatly into one area of government, such as public health, public safety, or public housing. It's a complex, interrelated problem that needs to be addressed as such. The unsheltered homeless, who many of us identify as the problem, only represent a small fraction of the total homeless population. Think of the problem as an iceberg, with the unsheltered being that tiny portion above the waterline, and the true breadth of the massive iceberg below the waterline, sitting there ready to sink us if we don't navigate it properly. We are fortunate in Hennepin County to have a veteran navigator of the homeless problem, Mr. David Hewitt. I met with Mr. Hewitt last fall to learn more about local efforts to address homelessness. I have to say that having worked in Hennepin County as a sheriff's deputy for 33 years, and having seen previous efforts to address homelessness come up somewhat short, I was a bit skeptical. But I came away from our meeting more informed and more understanding of the complex nature of the problem. And most importantly, I came away more hopeful of the efforts underway and the progress being made under Mr. Hewitt's direction. When I asked him if he would share his information with our audience, he happily agreed, and I'm thankful he did. David Hewitt currently serves as Hennepin County's Director of Housing Stability. His career spans over 20 years in both public sector and nonprofit efforts in the United Kingdom, Cambodia, and now here in Minnesota since 2016. His ambitious goal is to make homelessness in Hennepin County rare, brief, and non-recurring, something I believe we can all support. So please help me welcome David Hewitt.
Thank you all, and thank you, David, for the gracious introduction. I've just been told, and I've never heard this before, that you should take off your name tag when you come to the stage. It's distracting. So this is new information for me that I'm going to act on right now. So good afternoon, everybody. As you've heard, my name's David Hewitt. I'm glad to be here today. As I've spoken to a few people here already, I'm a firm fundamental believer in transparency of government, that we want to tell people what we're doing, how we're doing, why we're doing. I am also a firm believer in data and sharing the complexity of the problem and the challenges we face in the most kind of accurate and comprehensive way possible. Bring the mic, there, I see it. All right. And finally, I will say that I'm extremely proud of the work that we at Hennepin County have been able to do these last few years along with our community partners, and I will be sharing that information with you as well. So those are kind of the pieces I'm going to walk through here. Just to start with, though, I'll say a little bit more about myself. You heard a little bit there from David. So I started work, well, as you all would have gathered by now anyway, I'm not originally from Minneapolis. I started working in this field in January of 2002 in a homelessness nonprofit in East London. I worked in our drop-in center there for a spell. And I stayed with that organization for 10 years. I managed housing programs around the UK. My final contribution there was to design and manage a nationally funded project that helped more than 8,000 people move into housing over a 3-year period. So I was very proud and privileged to participate in those efforts. I then moved to Cambodia and I worked in Phnom Penh for 4 years, initially for a small grassroots organization that worked with young people and children who were living and working on the streets of Phnom Penh, connecting folks back into school and other opportunities. That was twice nominated for the UNICEF Sport for Education Award. I also worked for an international development organization working on improving teaching standards in schools for children in the poorest areas of rural Cambodia. And then I moved to Hennepin County in 2016, as you've heard. If you are wondering why there and then here, I just follow my wife where she wants to go. I work out what I'm going to do when I get there. That policy is broadly working for me. At Hennepin County, as you've heard, I'm the Director of Housing Stability. I've been in a variety of leadership positions in this space since early 2017. And I thought just to start with, to kind of frame up what I'm going to talk about and how I'm going to talk about this today, I wanted to share a couple of core beliefs that I have and that we have at Hennepin County around homelessness. And this is the first page of our current strategy document. It's on our website. I believe that homelessness is unacceptable. I believe that one person outside is one too many. I believe that one person in shelter is one too many. I believe that nobody should be without the safety, security, and dignity of a home. And that is how we think about homelessness at Hennepin County. I also believe, and this is the thing that needs to be paired with that we can do something about it. It's a crisis, and it's a crisis we can do something about. And I'll be sharing with you what some of those efforts have looked like. But fundamentally, I believe that housing ends homelessness, that we are able to provide people with the security of housing, and people can be successful in housing. Before I get into our strategy and the tactics, I want to start by talking a little bit about who experiences homelessness in our community, in part because, as David alluded to, homelessness is broader than sometimes the small piece that we see, the iceberg metaphor that you use there. I will be talking about homelessness. I'll get into more detail and into more granular detail, but at large, when I talk about homelessness, I'm talking about anybody staying in a place not fit for human habitation. And I am talking about anybody staying in an emergency shelter because they have no other safe option. And that's kind of the broad definition of homelessness that I'm going to use. We collect data in a lot of ways, and I'm going to share a lot of data with you in this half hour before we go to discussion. One of the first kind of things that I want to speak to in that data is this piece of who experiences homelessness and some of the perceptions that surround it. The first one I'm just going to come straight out and talk about is chemical health and mental health. This is often the first thing that people may think of when they think about homelessness. What I will share with you is when we look at everybody that experiences homelessness, and I will refer often to our point-in-time count data. This is our federal report that's carried out across the country. There are caveats around it, I can talk about those further, but it is the most consistent form of data collection around homelessness trends and trajectories in communities across the country. What we see in that data is that around about 12%, in our last study, around about 12% of people experiencing homelessness identify some kind of challenge around chemical health, chemical dependency, and around 22% some kind of challenge around mental health. Now, of course, that's a complex issue in and of itself. Both are, in terms of is that cause or consequence of homelessness and the other factors that go around it. But I want to call out that those are, while disproportionately high, still rather low percentages compared to the thing that everybody who experiences homelessness has in common. What 95% of the 5,500 people that will use shelter in Hennepin County this year, the 1,000 families that will use shelter in Hennepin County this year, what 95% have in common is an income below 30% of the area median income. And I apologize for this brief diversion into housing policy wonk language. I will try to steer clear of it for the most part, but this is how we categorize and think about affordability. And the deepest level being this 30% area median income. What that means, to put it in real terms, is for a family of 3, their income is $31,000 a year or thereabouts or less. For an individual, $22,000 or thereabouts or less. In Hennepin County, we have, this is the sobering slide, and this is the sobering part of the presentation. I will get to the hopeful part, but I like to start with the reality. In Hennepin County, we have approximately 53,000 households in this income bracket, in this income level, or below, in need of housing, and we only have 18,000 units of housing that are affordable at those income levels. If you're quickly doing the subtraction there, it's 35,000. We have 35,000 households in deep poverty who have literally no way of accessing housing that is affordable to them. Now, not every one of these households experiences homelessness, of course. Many are doubled up, are paying nearly all of their very low income already towards their housing cost, putting their other basic needs at risk. But pretty much, again, that 95%, everyone that experiences homelessness comes from this group. So I like to start with this, one, to set this goes to your iceberg analogy again, but one, to set out kind of the scale of the challenge, and also to set out another fundamental belief of mine, which is that a root underlying factor in homelessness is simply a maths problem. It's about income against the cost of housing. I'm going to move on to a second piece, because even within this group, so pretty much everyone that experiences homelessness comes from this group, but even within this group, not everyone is equally at risk. And in every presentation I give, county commissioners, everybody else, what I am going to talk about is race as a factor in who experiences homelessness in our community, because to a wildly disproportionate level, over and above what poverty alone can explain, and poverty is already disproportionate in communities of color, over and above that, we see higher rates of homelessness than poverty can explain. So while our African-American residents are overrepresented in poverty already 2 to 3 times, when we look at homelessness, it becomes 5 to 6 times. And we need to understand the reasons for that, because it doesn't, something you'll hear me say often, it doesn't happen by accident. So we need to understand the reasons behind that, and we need to build them into our response, and that is what we aim to do. In particular, I will call out 2 drivers. We worked with a national research company a couple of years ago to dig into this issue. I will call out 2 drivers of this disparity. One is what I call the inequity pileup. We are all familiar with seeing data like this across multiple systems: education, employment, criminal justice. Where we see multiple inequities that impact communities of color, they multiply and compound the number of barriers that people have to housing stability and housing success. So we need to be aware of that and responsive to that if we're going to advance equity in our response. As a second driver, we see network impoverishment. I'll digress a tiny bit here. So the nonprofit that I worked for in London had a talking point that was, I'm just going to call it out as a well-meaning lie. We went around saying that everyone is 2 to 3 paychecks away from homelessness. It's not true. It's not true because the biggest protective factor most of us have against finding ourselves literally on the streets and literally in a shelter, I would not end up literally on the streets or in a shelter in 2 to 3 paychecks because my friends, my family, my community have the resources to support me. My parents own their own home, and I can go and stay in their spare room if things get really rough. What we see is where communities have been denied the opportunity to build intergenerational wealth. Friends, families still want to help, but do not themselves have the resources to do so, and may themselves be tipped into crisis by trying to assist their friends and family members. And this, sadly, as a result of historical, structural, institutional racism, is concentrated in our communities of color in Hennepin County. Again, we have to be cognizant of this, and we have to have this lens as we approach our work around homelessness. All right, stepping forward into the work of the county. We are, as you have heard, and it's where it gets confusing, one of these tiles. There are multiple government operators in this space: the state, the city, the public housing authorities. If you're wondering, I'm in the 4th thing along Hennepin County Human Services Department. That's where I sit in this chart. I should also say this chart is only kind of which government entities work in this space. We work deeply and closely with the private sector, with the non-profit sector. All of us have to work together. We all have a piece of solving this issue. But the county's role is around human services, my part, and we also have a housing redevelopment authority that is involved in the financing of affordable housing as well. So what does that mean? What does that look like? I'm going to describe the work of the county in a few different ways. I'm going to start with an obvious way to do it, which is just to put a dollar figure on it. The county, we say, leverages approximately $146 million every year towards housing and homelessness. We do so across this full continuum that you see on the slide, from extremely low income up to moderate income housing. We fund operations, support services, and capital. Most of that 146 million is achieved by leveraging state and federal resources that we go after with gusto. In my area, it's one of our mantras. We are going after every dollar because a lot of them are competitive. We want to bring money and resources into our community. Just as one example, the single largest dollar figure in there is $80 million from the state's housing support program that comes directly to our nonprofits and pays for rental assistance and support services for approximately 10,000 people with disabilities in our county every year. So that's kind of the big dollar figure that we look at. I shared that we work across that whole continuum, but we are clear as Hennepin County where we need to focus our efforts. And it goes back to and it's why I shared those charts at the beginning about who experiences homelessness. We know that if we're going to address homelessness, we need to target resources to those folks with the very lowest incomes, which is where the risk of homelessness, housing instability, and the other risks that go with it are greatest. So you see here the honing in on emergency shelter, deeply affordable housing. That's where that housing support money falls. You also see here, and you'll see this motif repeat throughout my presentation, these two arrows: entering homelessness, exiting homelessness. I will say more about that shortly. Another way of describing this, so what does 146 million buy? We help more than 20,000 households a year through those resources. In some cases, that is one-time financial assistance to deal with that car breakdown, to deal with that shortfall in rent. In other cases, it's ongoing permanent supportive housing in those kind of 11,000 beds that are mentioned here. So that's kind of the scale of the work that we do and the number of households that we assist. And my last slide on this piece, David, you kind of already shared my mantra of making homelessness rare, brief, and non-recurring. And I'm going to explain what I mean by that. And this is really how our strategy is structured. It's how my team is structured. Firstly, number one up there, make homelessness rare. So we administer rental assistance and other support services to households that are in danger of losing their losing their housing, to keep them in their homes. That's the best and most cost-effective thing we can do, is keep people in their homes in the first place. Make homelessness rare. Stop that first arrow of people entering homelessness. The second, point two, make homelessness brief. This is the part of our work. We are the major funder of shelter in our community. We are the major funder and operator of outreach for folks on the streets in our community. And our thinking about our role there is very clear. It is to help people get out of those situations and into housing, to make homelessness as brief as possible, to help them move on as quickly as possible. That is what we believe our role as the county is. And finally, make homelessness non-recurring. The funding of supportive housing and other efforts that mean that once people are able to exit homelessness, they're able to stabilize, they're able to be successful in their housing. And I'm going to talk about some of those efforts and the success we've seen with them. First, I'm going to talk about the trajectory we were seeing before the pandemic. I'm going to talk a little about the pandemic and the changes we're seeing now. I mentioned our federal point-in-time count already. We do it every year. We do it every January. It's a combination of getting data on everybody that's in shelters and transitional housing projects, that higher box, which says about 2,400, and literally outreach workers and others, volunteers going out on the streets, on transit, everywhere we think we might need to be, to identify how many people are experiencing unsheltered homelessness on a single night in January every year. And all around the country, everyone's doing this. It's not a perfect methodology, but its benefit is it's broadly the same methodology year after year after year across the country, which means you can look at trajectories and trends. What we saw in 4 of the 5 years leading up to and including 2020 was the number was almost exactly the same. So we went out one January and the number was 3,058, and we went out the next January and the number was 3,059. Now, it wasn't the same 3,058 people plus one more, because every single day people are leaving homelessness and every single day people are coming in. That's those 2 arrows. What it shows us is those 2 arrows were broadly in stasis, that for everyone leaving, one more person was coming in. And there were some other changes happening beneath the overall numbers and the surface of that. One, which has already been alluded to, one of the major challenges we've been facing here, not to the same scale as colleagues and communities on the West Coast, but that we've been seeing here through that period, was a dramatic increase in unsheltered homelessness within that count. So although our count is still 80% sheltered to 20% unsheltered, and you can flip that on its head for West Coast communities, but that's kind of where our count worked out. But that 20% had been steadily growing, and that's what you see here. I should be clear that when we talk about unsheltered homelessness, much of the focus is on encampments. Even within these numbers, encampments represent a relatively small portion of this. We generally estimate between a quarter and a fifth of this number are in encampments. But that piece was growing and unsheltered homelessness growing more generally. If you are wondering what was offsetting this, obviously the numbers in shelter were reducing during this time. And very specifically, which I'll say a little bit more about shortly, family homelessness was reducing in Hennepin County through this period. So the numbers of families with children using our shelters actually dropped very significantly from 2014, when more than 1,500 families used shelter, to 2020, when we looked at, actually I'll use 2019 because the pandemic throws everything out, in 2019 where it was just over 800. So we saw a very dramatic decrease in the number of families using shelter, but alongside it, this very, very disturbing trend of single adults increasing and single adults in unsheltered spaces increasing, which is where we see the greatest risk from fire, infectious disease, violence, exploitation, and also the greatest impacts on public health and public safety. So that's what we were facing. We spent 2019, we had the Wall of Forgotten Natives in 2018. Our partners did incredible work with the Navigation Center, rehousing folks in 2019. Our team spent time with an advocacy group called Street Voices of Change, who are people who had experienced homelessness, to look at what was not working in the shelter system. And their shelter bill of rights came forward. We were working with our nonprofits, and we were looking at our family system and saying, why is the family system working better in a very tough overall economic environment? Why is the family system working better than the single adult system? We came up with a lot of strategies around this. The family system was better structured. You had 24-hour access. You had more consistent access to case management to help you find housing. We saw similar benefits in the Navigation Center, and we saw the same themes arising in our work with people with experience of homelessness. So we came up with a plan, and then COVID. And plans kind of actually didn't go out the window is the encouraging thing, even if initially it felt that way. Certainly I've been reliving these days recently for a variety of reasons. It's kind of 3 years since I had an office, I think, almost to the day. But we were thrown into a pandemic response. I vividly remember taking a call from our emergency management person. I was in a bar. I was watching the TV screens, which had the news coming from Italy around the pandemic. And I got a call, and they just wanted to know, how many seniors do you think we have in congregate shelter right now? That's something we've been worried about for a while. The number of seniors in shelter has been increasing for a number of reasons that I can discuss. I guessed that the number would be 100. It was actually 101. That was one out. We started putting in place that day a plan to get everybody that was age 60 and above out of shelter as soon as we could. Knowing that this was where, based on what we knew, knowing there was a lot we didn't know, but based on what we knew, the greatest health and safety risk to our most vulnerable residents was having seniors sharing congregate space in our shelters where the risk of a COVID outbreak could lead to incredible medical complications, indeed fatality. I believe March 17th was our board meeting where we issued the initial $3 million to start moving folks out of congregate shelter. And March 18th, we had Metro Transit buses rolling up to the shelters to move everyone age 60 and above to a new non-congregate shelter in a hotel where people could close a door behind them, have their own bathroom, and we could bring down their level of risk dramatically. I believe we were the second community in the whole country to take that step. The CDC guidance did eventually recommend it about a month and a half later. I believe Seattle did it before us. Seattle had COVID cases before us. I would argue we were the fastest. If you're not picking up, then I'm competitive. So, in total, we moved 1,137 people who were age 60 and above out of shelter into what we were calling protective spaces in that first year of the outbreak. We also set up spaces for folks who had COVID so they could recover and avoid transmission to others, and more than 1,000 people made use of those. It's an incredible undertaking. Everybody involved did incredible work. It's the stuff that, I always say at the end of the career, this is the thing you will look back on and feel most proud of. At the same time, and to this point about the strategy, we knew this was not a sustainable strategy or something that we could do indefinitely. And you see on this chart here, $16.5 million a year just to operate those additional protective shelter spaces. FEMA still owe us some money. We're going after it. But it was the step taken to protect people's health and safety. But very quickly, we pivoted to say this isn't a long-term solution. It's not a long-term solution for these individuals. It's not a long-term solution for our community. We stood up a case management team. We started buying hotels. They could be long-term affordable housing. And our case management team started working one-to-one with every single person in there to say, we need to get you out into permanent housing. You need somewhere to live that's yours, ongoing. What you see here is at the beginning of 2021, that was our largest portfolio. We had 540 people in hotel rooms. March 2022, we were down to 0, and we achieved that by moving 464 people, seniors and those who were medically high risk from COVID, into permanent housing with a 97% retention rate in housing. So even as we were in this crisis response, we were trying to pivot to longer term, and we were learning from this that there was something here. This I love. I just wanted to share it. I almost put a video in here, but I never trust how sound is going to work on systems I don't know. The last hotel shelter that we were able to end the operations of and are now converting to affordable housing had this mural on the wall. And every time somebody moved out of the shelter and into permanent housing, their own home, they got to add a flower to the wall and their initials or their name on it. So I shared this just as kind of a way of personalizing a lot of the numbers I'm talking about, in that every one of these flowers represents an individual who, after a long experience of homelessness, was able to move to permanent housing. And that was what we were all working towards. And like I say, so we were learning stuff and we were refining our strategy. And what really came out of it, and what I now kind of hang my hat on, is you need a strategy that works at 3 levels. You need the individual level. You need that person working one-to-one alongside the individual experiencing homelessness towards housing as a matter of urgency and priority. You need to be working on continually increasing the quantity, quality, and variety of housing options available to people. And at a systems level, going back to those kind of discussions with Street Voices of Change and others, we need to be working with people with lived experience of homelessness to understand their needs, understand the solutions that are going to work for them. And this is kind of what underpins all of our work now. So here's where we are. Here's how we're moving forward. Again, it's those 2 arrows. How do we minimize the number of people coming into homelessness, maximize the number of people exiting, so that when we come back a year later, the number isn't the same, or worse yet, increasing? I'm firmly of the opinion that the only way that we reduce homelessness in our community year on year, make it rare, brief, and non-recurring, is if we can reduce the number entering homelessness, maximize the number exiting. And these are strategies that we are putting in place and have put in place to support that. The first, stopping people becoming homeless in the first place, the obvious one has been emergency financial assistance, and we have been going after every state and federal dollar to do that. We know that the primary reason that people face evictions, for instance, is a debt in the region of $5,000 to $6,000. For what it's worth, that's the cost of supporting a family in shelter for about 1 month. So we think it's a much better use of money to assist people through that bump. We need people to be able to grow their income, to be able to be sufficient as well. But how do we help people through those crises, especially knowing that the inability to do so is concentrated in communities of color? Legal support and services for households facing evictions. Our housing court is very, very fast. It's very, very confusing. Hennepin County, we've put legal supports, we've put human services navigators at housing court to level the playing field and try to come up with the best solutions for households. Renters and property owners are very dependent on each other. We believe that we can meet the needs of both of them by helping folks stay in their housing. And targeted supports for high-risk households. We're about to roll out a new network of school-based homelessness prevention. So we're already working with Minneapolis schools, Osseo and the Brooklands, and we're expanding that this year to more school districts to identify households early that are at risk of homelessness and get cash and support to them to stabilize them in their housing so we don't have to see them in shelter, where issues become more challenging and more expensive. Even with all of that work happening, there are people homeless right now, far too many, and people will continue to fall through that safety net. So we need to maximize the number of people exiting homelessness. We have put in place a whole bunch of new initiatives here. I'll come on to how. Diversion. This is actually, we call it our Hennepin Shelter Hotline. People call it. Catholic Charities hold the contract. What they do is they work with people to see if there are safe, affordable alternatives to the shelter system before referring them into a shelter. Just last week, they helped 17 households, 7 families and 10 individuals avoid coming into shelter. Folks who were phoning saying, I need to be in a shelter tonight. They were able to work with them with some flexible cash assistance, problem solving to say, let's help you find something else in your community that doesn't require you to enter the system. Low barrier shelters, there's been a lot of news, and one of the articles in the handout includes information on Avivo Village, which is a really intensive shelter focusing on those chemical health and mental health needs, because where they are the challenge, they are a major challenge, and we need better support services for folks in that situation. Also in this category, I include the American Indian Community Development Corporation's Homeward Bound Shelter. One of the things, again, that I'm most proud of from the last few years was working with AICDC to establish a culturally specific shelter that could serve a community that is disproportionately impacted by unsheltered homelessness. Streets to Housing, this is a new team in my area. Half a dozen people, they are out at encampment sites and other hotspots. They work with people with experience of homelessness to say, where do we need to be? In a single week, just a couple of weeks ago, they helped 13 people on the streets move into housing. 1 week. And housing-focused case management, and if I was going to run up to the screen and put a big red circle around anything, it would be this. I talked about the 464 from the hotels into permanent housing and how we learned something. So we ended that in March of last year. And we said, well, this is great. Let's keep going and let's roll it out to folks who are on the streets and in other shelters. And since doing that and expanding the team again, we've helped an additional 448 as of this morning move into permanent housing, about half of them coming directly from the streets. Supportive housing strategy, Hennepin has been investing deeply in new buildings that have units dedicated to our most vulnerable populations. Some of us will be at an opening, a ribbon cutting this evening of a new project that has 20 units for people coming out of chronic homelessness. And the single room occupancy housing. This is those purchases of hotels that are now being brought into use as deeply affordable housing, because we have a lot of folks in our shelter system who are working and their incomes are just too low to provide for anything other than living in the shelter. But we hope by having safe, dignified housing that's $400 or $500 a month, that folks can be stable in that housing. It won't work for everybody, but there's a significant portion of the folks that we are currently serving in a system that just need deeply affordable housing. So these are all the things that we are doing. How are we doing them? Well, in part, we are using pandemic recovery funding, and we are using it in a way that other communities have not. About 40% of Hennepin County's pandemic recovery funds have gone to housing and homelessness to support these efforts. Most of it in capital, because it's one-time funding. Some of it supporting operations of services that we believe are badly, badly needed. And we are working at the state to see about continuing those. We were grateful to the Star Tribune's op-ed piece highlighting their success recently and calling for their continuation. Because we are seeing success, this is my last couple of slides, we worked with HUD technical assistants. Well, they were kind of told to work with us, and I'm not sure who got to say how it was going to go at the beginning of the pandemic. And one of the things they created for us was a dashboard that collected data from every single program and said, how many people is your community as a whole moving from homelessness into housing every single month? What you see here, the green line is pre-pandemic. The purple line starts October 2020 when we started making these investments. So what you see is every single month since we started implementing these strategies, we are moving more people from homelessness into permanent housing. And we are moving people with very, very significant barriers to housing success into housing and seeing them stabilize there. This chart is actually, it's a little bit different. It goes back to the middle of 2017 when we developed a by-name list, building off the work that we've done around veteran homelessness. We developed a by-name list of everyone who was chronically homeless in our community, and we started measuring how we were moving them into permanent housing. This is folks who've been homeless, well, on average, almost 4 years. This is my favorite statistic, so it's probably going to be my second from last that I share. What you see here is since that period, this group, folks who've been homeless 4 years, in some cases 10, 15 years, we've moved more than 1,300 people from that background into permanent housing across a whole range of programs. There's no one program that does this. A whole range of programs, a range of efforts that are person-centered. Each of them having been homeless on average 44 months. That is more than 5,000 cumulative years of homelessness ended, with every reason to believe that these individuals would have continued experiencing homelessness without that intervention. Now, I'm going to come on to the point that we also know there is a ton of work still to do. We still know that the crisis of homelessness is far too great in our community. It impacts far too many people. But what we see in this chart and in these efforts is, going back to my fundamental core beliefs, that everyone is housable and we can be successful. And the one statistic that isn't on this actually that I'll also share is 94%, I believe we are at for this group, have not returned to homelessness. So folks with 10 years of homelessness in their background getting into permanent housing with the right supports can be successful. All right. Point in time count. I brought you up to 2020. I'm bringing you up to date. 2022, we went back again, and we did not find a count of more than 3,000 people. Still far too many people, but a count of just shy of 2,700 is the lowest point in time count for homelessness in Hennepin County since the count began in 2005, and a 24% reduction in unsheltered homelessness after years of increases leading up to the pandemic. This is one of those things that doesn't happen by accident. Didn't happen around the country. You look at Denver, 33% increase in unsheltered homelessness in the same period. One last caveat, and this is one of those things where we can just see something working and we see when it goes away. Our family shelters were kind of empty during the pandemic. It's remarkable. It's one of those things that nobody noticed because you can't see what isn't there, right? But people serving people was down to kind of a fifth of occupancy, a quarter occupancy. While the pandemic supports were in place, emergency rental assistance was in place, family homelessness just dropped. And when they went away at the beginning of 2022, it came right back to where it was before. We literally have 300 more children in shelter today than we did this day 18 months ago. But it's back where it was before the pandemic. So we see something that just absolutely worked, and we see what happened when it went away. All right, the future, and then I am done, David, sorry. And this is just like really to focus on that theme, and again, why we focus where we focus as Hennepin County, entering homelessness, exiting homelessness. This was where we were, this is where we were stuck with this worrying trend of increasing unsheltered homelessness. Things can go either way from here. They can get better and they can get worse, and we see that with the cautionary tale of West Coast communities where they see unsheltered homelessness at 8.5, 10 times our rate, not number, rate, as a proportion of the population. So this is like my scary, ugly slide, which I know our communications people hate. This is kind of trying to graphically represent what it would mean if we saw more folks coming in than we're exiting. This is what happens if we take the eye off the ball, if the forces become too strong in this direction. We will see more and more folks coming in, fewer folks leaving, and the number year on year will grow. This assumes the proportions of sheltered, unsheltered stay steady. I don't think that's true. The number of unsheltered will always grow quickest as pressure on shelter occurs for a variety of reasons. But I think this is the path that we can set ourselves on year work towards, which is if we can just reduce that number coming in, even a small amount, increase that number exiting, even a relatively small amount, year on year, we can see fewer people in our shelters and on our streets. And that's where we are working to get towards, and that's what our strategies are all pointing towards. That is me done. I haven't been timing myself. I may be way over. I apologize. Thank you all.
Well done. Is this on? Okay.
And this one?
Well, we've got a good solid 20 minutes for question and answer. Thank you for the presentation, David. I'm going to ask the first question to prime the pump here. One of the really interesting things that you talked about, and I'm hoping you can elaborate, when we met was just that interplay between using the iceberg analogy again. Every time you found that every time you dealt with the unsheltered population, you risked the churn of bringing people you didn't even know were homeless up into that unsheltered category. So can you talk about that?
Sure, David. Yes, thank you. I mean, what we see with the iceberg analogy, of course, is that there are many, many, many people in crisis that are out of our line of sight. And people in crisis and in need of resources, seeking resources and seeking help. And what we have seen is that if we are not thoughtful around how we prioritize and how we structure our help, we risk creating incentives for people to put themselves in more risky situations. We don't want people to put themselves at risk to access resources. And that's something that is a tension that we wrestle with, frankly. We want to bring resources to those who are at greatest risk, and we don't want people to put themselves at risk to access resources. So I know this is what you're kind of referring to, David. And it's something that, we wrestle with as a human services department is we believe that everyone can be housed. We believe in working on risk. The way that we do this is through partnering with all of the shelters, all of the outreach teams, and making sure we have in place an equitable, effective, and efficient means of prioritizing people for the resources that become available so that wherever they appear in the system, they have equal opportunity. Because we want to reduce any kind of incentive for people to put themselves at greater risk. But yeah, it's a very real challenge in the world that we work when demand for resources exceeds supply.
I think specifically one of the things you were mentioning was as authorities were trying to tackle some of these encampments and disband the encampment, you learned some lessons such as if we give them too much notice or promise everyone at the encampment is going to get shelter once we come, it had a tendency of pulling people up above that line.
So David, I think specifically when I look back to the Hiawatha Franklin encampment, which was the first and at the time the largest encampment we'd seen in the state of Minnesota, we had services there through our partners, in particular through our incredible partners in the Native American community every day, to try and get people into shelter when that was the option available to them or wherever else could be safe. But we did see a tension, and we absolutely saw a danger when a perception arose that housing options would be available here that were not available in shelter. And we had to do some backstop work with the shelter, with the family shelters, to communicate to people, there will not be a faster track to permanent housing by putting yourselves at risk. Because we saw that kind of momentum, that risk and that momentum growing, and had to step into that space to make sure that we held fidelity to that equitable, effective, efficient allocation of resources, and tried to make sure that people weren't putting themselves at greater risk, because there was that potential and that danger, and there were instances in which that occurred.
Great. Catherine?
If you have a question, go ahead and raise your hand, and I'll bring the mic to a couple of you.
Yes, I know the United Way has studied this issue as one of the prime ones they want to support. And obviously they're not going to be building shelter, but they came up with a solution of the two target groups they wanted to focus on were, one, people coming out of a prison, and secondly, people coming off of foster care. Could you comment on those two as target groups?
Yes, thank you. Absolutely, those are... particularly when we look at, for instance, youth homelessness, we see a very, very high percentage of folks have come out of previous systems, including criminal justice and foster care. So certainly we have been working with, and recently worked with, the public housing authorities to get vouchers specifically for youth who have a history of foster care involvement. And we were successful in getting a federal grant around youth homelessness to provide support services to pair with those rental assistance vouchers for that exact reason, because we need to get upstream of this issue. It's this constant question of how do you target and where do you prioritize when there is so much to do. But in order to get upstream, looking at youth homelessness, foster care, the criminal justice system, these are absolutely places where if we can intervene effectively early, we can have a really beneficial lifelong effect in the lives of young people. So I completely agree with those targets, and certainly they're ones that we work on as well.
Congratulations on the successes you've had. When you started, you talked about how it was complicated and there are a variety of reasons for the problem. But you also highlighted the idea of institutional racism. And I think when you take a look at over 50 years of preferential treatment, these numerous programs, nonprofits that have grown over 50 years, trying to provide support, school districts in the large cities spending way more per pupil than typical school districts. I think that's an issue you maybe ought to evaluate as to whether you're going to try to have that as a primary reason, institutional racism, for the problems. So I just want to get your reaction to that.
So, I mean, in reaction, I mean, I would go back to when we've looked at the data and we've looked at the underlying causes, we have seen those inequities with systems like foster care, juvenile justice, the disproportionate number of people of color that enter into those systems and the impact that has on long-term housing success. And the other big piece has been the lack of resources in communities that haven't been able to develop intergenerational wealth. So, I mean, those are the things that we have identified as the drivers there.
Talk about the effects of rent control on homelessness.
Thank you for the question. I will immediately say that anything I say is essentially going to be somewhat speculative. You know, we are talking about theoreticals, at least here in the city of Minneapolis. I think the fundamental issue of having 35,000 households in deep poverty with no housing they can afford will not be addressed by controlling rents that are already out of reach of those households. So what I will say is I don't want to weigh into a conversation at large about the rights, wrongs of that policy, but what I will say in terms of homelessness and what we need to do around homelessness is we need to address the supply of affordable housing and people's incomes, and I think those require different strategies.
Yeah, thank you for your presentation, David. Question, if this is specifically regarding tent camps, I know there's a myriad of issues in terms of homelessness, specifically tent camps. If you knew you could not fail and money was not an object, it was not an issue, what are the top two things you would do so that using your word rare, tent camps were rare or non-existent, and again, you cannot fail and money is not an issue, what would you do?
I like this thought experiment. So I do believe in the strategies we are implementing, and I think we could double down on them further if money was no issue and you could not fail. I basically believe that the two things you need, and it's interesting because we go back to kind of the issue being complex, and yet somehow it isn't at the same time. You need places for people to go and people to help them get there if they have a lot of barriers. I think it's supportive housing. I think that includes subsidy and rental assistance for households that have extremely low incomes. Supportive housing should always have an element of building sufficiency for those who are able to seek employment as well, and that should be a part of it. But I think it's supportive housing at a scale that we do not have right now, and housing-focused case management, people who have that trauma-informed, person-centered approach to go in, work alongside the individuals to get them there. We are seeing the success of that, but not at the scale that we need to have it at right today.
I have, but last time I did look, there was still a tent camp over by Home Depot, quarry area of Minneapolis, 35.
I believe the specific site you are referring to is no longer the site of an encampment.
Okay, and how did you get rid of it? What was done?
So I should be very clear in response to this that I work in the Human Services Department and my role does not include the closure of encampments. That's carried out by other entities that are managing the properties on which they reside. My team go out to these spaces, work with the individuals in them and try wherever possible to get them into those safe, dignified alternatives. And we are working with individuals at that site, we're working with individuals today at other sites, and that's the work that we keep doing but closure itself is managed elsewhere.
A question. Since the pandemic, we've had a lot of in Wright County people that are having a hard time because they've gotten an eviction, and then a lot of these renters are not allowing them to come back because they're cracking down if they see an eviction on there because they were stuck paying, not getting rent during the pandemic. What are you doing for that?
Yeah, thank you. And we have seen, coming out of the eviction moratorium, which coincided with the end of a lot of the federal emergency rental assistance, we have seen that very well publicized spike in evictions across the state, certainly in Hennepin County. Within Hennepin, seeing that was a likely outcome of those changes, we invested a piece of our pandemic recovery funding into legal representation and support services at housing court for all low-income renters. So any low-income tenant who comes to housing court in Hennepin County will get those supports. One of the things that we tried to do, to your point, is, of course, it's great if we can connect people with the financial assistance, resolve the issue, and help them stay in their home. That's goal number one. Goal number two is, if this tenancy isn't salvageable, if it can't be sustained, can we at least work to avoid the eviction on the record and to get the person more time to move out in a way that serves both parties, but keep that eviction off the record so that it doesn't become that barrier to future housing success. So we believe that even as we've kind of struggled in what some people have, I think, fairly called it a tsunami of evictions, we believe that putting those extra supports in have both kind of, to mix my metaphors, but blunted the spike, but also will allow households, wherever possible, to recover housing stability more quickly if we can keep the eviction off their record, because that's a very real challenge.
I was just curious if you visited other cities that are struggling with homelessness. You have?
Yes.
Okay.
Is there a second part to the question?
Yeah, there is a second part. Because I spent most of December and January this past year in Los Angeles. And I was just blown away. And I live urban Minneapolis. It is an insult to humanity. What is there? I came back to Minneapolis. No comparison. No comparison. Now, the thing is, though, I still think government has a blind eye to homelessness, even in our Midwestern city. You try to go into a coffee shop these days, and who's being invaded with the coffee shop? The homelessness. They're not buying anything. They just need to buy time. Businesses have to shut down or they have to lock things up because the homeless come in there and try to steal things. That's a whole aspect of our society and homelessness, not just a bed to sleep on, but how it's affecting every one of us here every day, and we don't realize it. Has that sort of approach ever been considered, like downtown Minneapolis right now? And those encampments, I go all over on the bikes. There is an encampment, a big encampment off of Franklin Avenue. That's affecting all of us. So I think that looking at numbers and all of that is fine, but to me, it's invaded more of our society, and there needs to be more pushback to address it. I don't know if that makes sense, but go to Los Angeles. I went all over in the train and the buses. It's a disgrace.
Let me respond to a couple of the points raised there. Yes, I have been to West Coast cities, and the rates of unsheltered homelessness that they see are many, many times. Portland has 10 times the rate of unsheltered homelessness as Hennepin County. When we look at their point-in-town count numbers, their census population numbers, and then what proportion where in Hennepin on a single night, the number of people experiencing homelessness in total is around 1 in 2,600. Some of those West Coast cities, you get to kind of 1 in 100, 1 in 150. Much, much higher. It's at a scale unimaginable. If you haven't been there and you haven't seen it for yourself, it's quite hard to imagine how different it is from here. I will say, to some of the other pieces that you raised, one thing, to be very clear, I work in the Human Services Department. I am, of course, aware of, and people raise up to us, the concerns of wider community and the impact on them around, say, encampments. My focus is always, I make no apology for it, the people themselves who are experiencing homelessness and how do we connect them to safer alternatives, because I do believe that it is by reducing the number of people experiencing homelessness over time that it serves all of us better. It's by avoiding that West Coast scenario, working to reduce the numbers of people in crisis that serves all of us better. So I hear what you're saying, but that's where I'm coming from.
Let me jump in and ask a very quick question, tying into her question. You shared some of it in your presentation, but here's a softball for you. What are we doing different in Hennepin that isn't being done in Portland? How are we not going to end up like Portland in 5 years?
Thank you. I will take the softball. And at the same time, I will try to avoid a critique of my colleagues in Portland who no doubt are working extremely hard and, as well. The focus, and it's one that we've talked about for a long time, and I think have not been able to fully realize in our approach, to work on ending homelessness rather than managing homelessness, I think is crucial moving forwards. I think where we put our resources and how we focus them are fundamentally the difference between how we are moving as a community and where I see challenges elsewhere. We don't want folks living in camps, we don't want folks living in shelters because we want to provide them with better alternatives. But we have to focus on that and put our resources into ending homelessness for people, not managing it, not these other things around it. We need our energy to be very strategically deployed. And I think that's what we're doing, and I think that's what's making a difference. But the other thing I would say is we have to take those steps before we hit that tipping point that those communities have, because I don't think that anything I'm saying is rocket science. I don't think this is complicated at some level, and I don't think that people in Portland haven't thought it would be better if we had fewer people sleeping outside, or it would be better to get folks into housing. I think that when you are at that scale and at that level of crisis that they are at, it is very, very hard to come back from that. That's why I am so concerned and committed that we keep our focus on reducing the numbers, reducing the impact, reducing the number of people in vulnerable situations, because I think there's a point, if you let it go the other way, where it's very hard to come back from.
Hi, two questions regarding the effort to reduce the homeless need. You had mentioned that there was a minority of people who suffer either drug addiction or mental health issues. Do you think that there's a need for more permanent, required for, let's say, halfway houses or others that are devoted specifically to those needs? And secondly, of the other group that you said really just needed economic assistance, how much do you think is affected by those moving in from out of state or out of country? Thank you.
Taking the first question first, something that you're highlighting there, which I think is absolutely correct, is, well, and again, this goes back to your opening comments, David, homelessness has people have different needs within this larger group of folks struggling with housing instability. They may all have low incomes, but there are different needs. And we do need to have that, not just quantity, but also quality and variety of assistance for folks. So yes, I think for folks where it's just an economic issue, that's where, for instance, single room occupancy strategy of just those deeply affordable, dignified housing options, we need to build that out. For folks struggling with dependency, I do believe we need more intensive, low barrier services that people are able to and feel good about opting into. I'm really proud of the work of Evo Village. I know it's got a lot of publicity, and I think rightly so. Not only have they helped people exit encampments, and that's really their focus, with chemical dependency and mental health challenges, they've helped more than 100 move on to permanent housing after their work. They've helped folks move on to treatment settings. So I think having more of those low barrier options so we can get folks into services and then connect them on to more intensive long-term options is something that we have needed in our community, and I think we're seeing the benefit of having it there. I will go back to, and again, it's in that op-ed piece, we need to continue the things that are working as well, and that's one of them. It is, relatively speaking, expensive to provide those intensive services, but we see the benefit and the transformative effect of them in our community. To the second question about folks coming in, we do get asked this question a lot. We look at, for instance, the 5,500-ish individuals that use single adult shelter in Hennepin each year. What we typically see and very consistently see is about 2/3 have a last residence in Hennepin County. The other third do come from the rest of the metro, greater Minnesota, other states. Of course, we also see outward traffic and migration as well. So there is movement that's inherent within it. I'm proud of the work that we do to shelter and serve the people we need to serve here.
We'll wrap it up there. If we could get a round of applause, please, for Mr. Hewitt.
David and David, thank you very much for that very informative program. We really appreciate it. And thanks to all of you for coming. Just a few quick announcements to wrap up our program today. First of all, American Experiment's annual dinner will be on May 12th this year. It will be at the Hilton Hotel in downtown Minneapolis, and Dennis Prager will be our keynote speaker. It's a fundraiser, of course. It's going to be a wonderful event. And so if you're interested in attending the annual dinner, now is the time to buy your tickets. Second thing I would notice is that we have a bunch of papers. We have copies of Thinking Minnesota, our quarterly magazine, research papers, and so on the table out here. Those are all free, and they're all intended for you. So feel free to pick up anything that looks interesting to you as you exit the program. And finally, American Experiment is a grassroots organization. We do not get any support from any government entity. We exist only because of people like you. On all of the tables, we put these business reply envelopes. They are suitable for inserting checks inside and putting in the mail. You won't need postage if you're not carrying a checkbook with you or a check with you today like me. You can take an envelope home, put a check in it, drop it in a mailbox. But we really need your support. We are a grassroots organization supported by people like you. So with that, we will wrap it up, and thank you all very much for coming.